Hello, my name is Clint Hartig, a physical therapist at SKY Rehab. One of the several ways we treat orthopedic injuries at SKY is with a technique called dry needling. Dry needling is a technique that uses an acupuncture needle, but we place it into specific muscles that are causing the pain. Specifically, we look for areas called trigger points, which is a tight band of muscle that causes pain in a localized or even refer pain to areas of the body that may seem unrelated. Along with pain, patients also see decrease in range of motion, which can cause issues with turning the head, reaching for objects, or even bending over. Oftentimes, electrostimulation is used in conjunction with dry needling in order to reset the muscle, relax it. That way we can increase your range of motion, decrease your pain a little bit quicker. The most common cases for dry needling involve low back pain, neck and shoulder pain, fibromyalgia, and even sciatica. Typically, our patients see a benefit within 2 to 3 sessions, whether that is increased range of motion or decrease in pain. If any of these symptoms sound similar to yours, come give us a call and we'll see what we can do for you.